Hi, my name's Dr. Jenny Wakely. I'm a GP working in the NHS and I specialise in dermatology. I also have a company called The Beauty Doctor, which specialises in cosmetic treatments and dermatological advice. So I'm here today to talk to you about how to get rid of excessive hair growth. Usually it's a problem in women, and it's either because of a male pattern hair growth, so more facial hair or thicker hair growth generally throughout the body. This is technically called hirsutism. What is considered hirsute depends on the culture and the race as well. It is nearly always genetic. Sometimes it's because of increased levels of male hormones in the body, but sometimes these hormones can be normal. In which case, it's because the hair follicles are more sensitive to smaller levels of male hormone. So the level is normal, but they're more sensitive to the action of the hormone. So the hair grows thicker and it is more as well in number. More rarely, it can be caused by polycystic ovarian syndrome, which is a hormonal imbalance where you get higher levels of testosterone in your body, or something called congenital adrenal hyperplasia. You probably will need to see your GP and he'll do some blood tests on you for male hormones to check for hormone imbalance. Especially if you've got period irregularities, it might point to polycystic ovarian syndrome or PCOS. Other blood tests may also be required. So depending on the underlying cause, there are various different ways of getting rid of the thick hair. There are physical methods, so depilatory cream, shaving, waxing, IPL, laser. The latter two are more permanent ways of removing the hair. A common misconception is that shaving makes the hair grow thicker. It doesn't. What it does is it cuts the hair blunt, so when it grows back it looks a lot thicker because the end is quite blunt rather than being tapered like a normal hair. The thing about using the depilatory creams is they can irritate slightly, so you need to be careful about that. To counteract hormonal imbalances, there are medical treatments that your GP can offer you. You can go on the pill. Some are more effective, such as Dianet or Yasmin. This can take about 6 to 12 months for the hair to grow thinner, so you do need to be a bit patient if you can. With any medication, there are side effects of each, and sometimes it's just a matter of trial and error. You can also in this country use something called Vanica, which is a cream which thins the hairs as well. But obviously once you stop using the cream, then the hair will come back thicker. So I hope this has been useful in trying to help improve increased excess hair growth, and thank you for listening.